Hi, everyone. Welcome to the SRNA consultation webinar for the CNA Code of Ethics 2017. My name is Carolyn Hoffman, Executive Director of the SRNA. We do have a few people online, but not everyone that we're expecting. So we're just going to wait a couple more minutes for people to join, and then we'll start. I'm going to, while we're waiting, can you please in the chat box, if your chat box is accessible and you're able to, can you share with us where you are joining from? So if you can just in the chat box, oh, look, there's Terry Belcourt, for example, sharing with us, good morning from Prince Albert. Apparently we look great, ladies. You look great, ladies. So that's good, Terry. Nice to get that feedback. On the top of Tony's head looks good too, Tony. So you're looking good. We're joining from, so it's Carolyn, Carol, Shirley, and Tony are joining from Regina. So if everyone else can just find your chat box and share a message about where you're joining from while we're waiting. Where are you?
Okay, we're gonna, yeah, very good. Excellent. Well, I'm fairly
We need you, Tony. Always need you.
They should go to the door or something like that. That's
Yeah.
what I'm always.
That's great. So we're just waiting for a few more people to join, and then we'll get started. I'll just indicate as well, this webinar is being recorded. We are going to record the presentation and the information presented, so that's available to others, but we're also going to record the feedback so we can refer to it and make sure we get everything right as we are compiling and moving forward with the consultation process. So just go on mute and we'll be back in 2 minutes. Hello, everyone. Welcome again. It's Carolyn Hoffman, Executive Director of the Saskatchewan Registered Nurses Association, and joining me today for the SRNA consultation webinar for the CNA Code of Ethics is
Carol Reese, registered nurse, and I'm an advisor with Competence Assurance.
Hi, I'm Shirley Mackay, RN, and also Director of Regulatory Services and Registrar. Pleasure to be with you today.
back up off screen, off the video is Tony, and thank you, Tony, for helping us out today with the support for the webinar. I would like to share with everyone that the webinar is being recorded, and I would really encourage you to share your comments, questions, feedback in the chat box, or you can also unmute and share whenever you like any comments or questions with us as we go through. So please don't hesitate to be able to share what your thoughts are and contribute anything that you'd like to talk more about. With that, we do have a presentation to walk through, and you can obviously share any comments as we go, but we've got some content we'd like to share with you. And the first one is, we want to talk a little bit about the timeline and why we're here today. And so all of you, I'm sure, are aware that this is the CNA, or Canadian Nurses Association Code of Ethics 2017 revision to the document, a consultation process. And this started quite a while ago. Over a couple of years ago, the Canadian Nurses Association did indicate that they were going to do a revision and update this, and began the work. In the fall of 2016, we did receive an early draft of the document, and we looked at it internally and provided some feedback. Then in April of 2017, a revised Code of Ethics and online survey was received. The Code of Ethics was received, and we sent it out to members for consultation. And there was a web and email consultation at that point with members. On May 3rd, at our SRNA Annual Education Day, there was a focus group for discussing the draft CNA Code of Ethics and getting feedback. And then in June, Carol Reese, Erica Vogel, Shirley, and others worked together to summarize the feedback from all of these mechanisms and send them back to the Canadian Nurses Association. A little later on, Carol's going to highlight some of the changes that occurred, and we did see changes as a result of our feedback, so we're very excited by that. And Carol's going to highlight some of those changes. The CNA board, and Joanne Peterson, our president, is on the board of the Canadian Nurses Association. The board reviewed and approved the revised Code of Ethics for the Canadian Nurses Association in June of this year, and they did approve it on the basis of the Canadian Nurses Association. What that means as a member jurisdiction within the Canadian Nurses Association, and with our history of using the Canadian Nurses Association Code of Ethics and having them in our bylaws and holding our members accountable to them, is that now, as the Saskatchewan Registered Nurses Association, we need to make a decision about adopting the updated revised version. In order to be informed about this, there is another consultation that was launched on September 25th, and that involves member and public surveys. And I think we've had a pretty good response. We're definitely seeing
98 respondents so far.
98 so far. Thank you, Carol. 98 respondents already on the online surveys. And today is a part of that consultation, but you also have the opportunity to go online, and we might actually stimulate your interest and energy to be online and to complete the survey as well. And that's okay too. We are open to your verbal feedback today, but also going online. We should let you know that you can go online and complete those surveys up to end of day October 16th. So that's not a long timeline at all. So this consultation will occur, then we're going to close off the survey on the 16th and compile all of our feedback into one document, and we will be taking the revised CNA Code of Ethics and the summary of our feedback from consultation to SRNA Council in November, where we assume will be making a decision one way or the other about adoption of the Code of Ethics, the 2017 version. If Council does decide to adopt the updated version 2017, there will be a need for bylaw revision. Bylaw revision is a process that happens over many months and culminates with our annual meeting in May of 2018, and our members will be asked to support and approve any bylaw changes at that time. So nothing happens immediately. We do have a process to go through if Council wants to adopt the new revised CNA Code of Ethics. We have been keeping you updated via the Executive Director messages, periodic messages to members, the news bulletins, e-bulletins, as this process occurred and is moving forward. And we'll continue to do that, and we commit to that to keep you updated as this process unfolds. So with that, we'll go to Carol to talk a little bit about what the Code of Ethics is.
So thank you, Karen. So Code of Ethics is a public declaration of the beliefs and values of the nursing profession and its members. It's a statement of the nurse's moral and ethical commitment to persons receiving care, and it's guidance for nurses in all contexts and domains of practice, as well at all levels of decision making. Thank you. The information assists nurses to practice ethically and working through ethical challenges that arise during the course of their practice with individuals, families, communities, and with public health systems. The expectations and guidance for ethical relationships, responsibilities, behaviors, and decision makings. It is a means for self-evaluation and self-reflection. And at this time of year, with our continuing competence program, this is an important opportunity for nurses to reflect on their practice, and it might even guide someone in their CCP this year for a learning goal. And it is a basis for feedback, peer review, and advocacy, which again feeds into our continuing competence program.
The Code of Ethics and Regulation. Again, the Code of Ethics is an integral component of professional-led regulation. And again, in the approval of nursing education programs, it's assumed the Code of Ethics is a part of the curriculum, and where appropriate, it is used and applied in clinical practice situations. Graduates of nursing education programs as an entry to practice level competency are expected to practice according to the Code of Ethics. In addition, the Code of Ethics is linked and part of our professional standards. You will see our competencies. Standard 3, ethical practice, the Code of Ethics is referred to, and there are an additional 10 competencies linking to the Code of Ethics. So the Code of Ethics plus our entry to practice, or our entry-level competencies, are very much linked together and set the standard. The Code of Ethics also is used to inform nurses, the public, of the ethical values and standards nurses are expected to uphold. And within that area, you will see that we have also included in our consultation public or stakeholder input, because it's so important that the people that we serve are aware of what is expected as a component of competent ethical nursing. You'll also see that the Code of Ethics, as Carol has indicated, is integrated into our continuing competence program. It's part of the reflection that we all engage in as in the course of self-assessment. It's also linked to the competence assurance, where there's a question about the professional conduct of a member, the code of ethics is then considered as well as the standards. Of note, certainly, is our obligations within the code of ethics in relation to fitness of practice, conflict of interest, mentorship for nursing. So this is a very rich document that does inform our practice and holds us accountable to the public for the standards of registered nurses.
Okay, the Canadian Nurses Association has created the code into two parts. One functions as a regulatory tool and the other as an aspirational tool. So those things that we strive to incorporate into our practice and for a better society as well. Structure of the code in part one is the nursing values and ethical responsibilities. There are 7 primary values, and I will go through those a little bit later, identifying which each one of those are. Those are the primary values that we do hold our nurses accountable to, and from a confidence assurance point of view, those are very important values that members need to display during their practice. Part 2 is the ethical endeavors. This is related to the broad societal issues. Addresses those issues such as poverty, violence, inadequate shelter, and describes the endeavors the nurses can take to address societal issues. These are aspirational. There's not something you can measure to hold nurses accountable to, but it's to help improve broader societal life. Couldn't think of the word.
Good description.
Okay.
It's a very important aspect as well to look at the code as a basis for advocacy. In a world filled with changes, challenges, with social determinants of health, or with the patient or client resident that's in front of you today, and the dynamic of the healthcare system. Could be any number of aspects. Look to the code as one place that you can find the clarity, the approach, the ethical process for considering and advocating where applicable for change on behalf of a patient or a population in Saskatchewan today. So it is something very important to, as Shirley has said, to know that we're held to it as registered nurses. So when we look at that, when we're held to something, sometimes we need to advocate when we feel that a certain outcome is not occurring or a certain process is not occurring for our patients, etc. So very important to mention. The code is a support to us as we face the challenges and changes that are relentless in the world when we think of the public and the public's desire for greater access to health information, expectations by the public, the demographic shift and what's happening in Saskatchewan every year in terms of that change in what we need to be thinking of and addressing with our population. In terms of things that affect nurses and other healthcare providers, and when we think of workload and the challenges we face in using resources very, very effectively and efficiently, but sometimes where do we turn to when we feel we have questions or concerns? And within the broader socio-political context, when we talk about disparities that might be out there. As has been mentioned already, and the push on the healthcare system. And today, as we're doing this webinar, we're moving to one Saskatchewan Health Authority. What does that mean, and what kind of things might come up? So the code, an excellent source of support and guidance on that. So in terms of changes that we see in the environment that specifically influence content in the new Code of Ethics or their updated Code of Ethics, there are a number of areas, and we've got them listed for you here. And inside the code, you'd be able to see this wording. The first one is medical assistance in dying. Very dramatic shift over a relatively short period of time regarding that in terms of the ethics and the legalities. When we're talking about the ethics, the Code of Ethics talks about that and gives us guidance on that. Advanced care planning becoming more and more prevalent, more and more a topic of discussion and work. Equity or disparities, as we said, on the other side of that. the shift for primary health care, so slow. So it's moving so slowly, but we know it's the right direction to go. And what knowledge, what's the latest in terms of that and incorporating that into the Code of Ethics. Job action, there are particular section on job action and the registered nurse accountabilities. The workplace bullying is now a concept that, of course, happened historically, but much greater discussion about it, recognition. Now there's clarity in the code around that, as well as a related topic of quality work environments. And then at the end, there's ethical models for reflection, a really good source of the latest in what we know about nursing ethical models. And there's no right or wrong one. There's just the one that's going to work for you in your career, and that might evolve over time. And this is at the back of the code, a great source of information.
Okay, summary of changes. What I've mostly noted, the 2017 Code of Ethics for Registered Nurses from CNA has been finalized, and this is the Code of Ethics that they have adopted. A lot of the changes that were noted from the draft document to the current finalized document were mostly related to terminology. There was some additions and deletions of phrases or words to help provide some clarity, to make the responsibilities more concise. Sometimes they took a couple of them and blended them together as the two ideas worked well together, fit together appropriately, so they made them into one. All these changes came about following consultation with registered nurses throughout the country and registered nurses here in Saskatchewan. And then CNA finalized and approved it in June of this year. So again, we're consulting with our members so that they have an awareness of what those changes are, what the final document looks like, and we're wanting your feedback so that we can provide direction for our council should they adopt these, if they should adopt this Code of Ethics. So I'm not going to go through each and every one of the changes that I've noted. I have gone through the document completely, and these are all changes. I'll just highlight a few of them. Number 9, the expansion of agencies to provide direction and policies for safety precautions. It's now very well laid out that these safety precautions are in accordance with legislation, regulation, guidelines provided by government, regulatory bodies, employers, unions, professional associations. So when someone is looking for some direction as to what are the appropriate safety precautions, there's a whole list of agencies there that should be providing that direction or providing the policies for them in the cases of disasters and communicable disease outbreaks. Okay. And then in number 2, I found it interesting. What I noted is in the old one, they used to talk about diagnosis and evaluation and forgot outcome planning, implementations, the whole nursing process. So anyways, that is now in there very detailed, that we use the whole process when we are determining care, working with families, individuals, and communities in the healthcare sector. In this one, promoting and respecting decision-making, number 6 was previously number 8 in the old document, but I liked that they had gone ahead and nurses provide education to support informed decision-making. So the onus is on us to provide that education so that capable people can make decisions, and that if they make decisions that maybe are not in line with our ways of thinking, that we continue to provide care for them in a non-judgmental manner, which I think is very important, because there have been times where people have felt judged for the choices that they've made. Okay. Honoring dignity was actually changed from preserving dignity. I actually like the word honoring better than preserving. I think that's an excellent word change right there. Number 6, when providing care was removed, but this used to refer to restraint usage, and restraint usage has been removed. It is when providing all forms of care. We want to minimize risk and maximize safety to those who are receiving care. So it doesn't just deal with that restraint use. Well, it doesn't deal with restraint usage at all anymore. Also, number 7, they're very clear about professional boundaries and personal and professional relationships. That nurses do not enter into personal relationships, and they very specifically romantic, sexual, or other with persons receiving care in their care. Okay, and then number 8, sorry, they listen attentively to a person's wishes and support person's family and community has been removed. I'm not entirely sure why they did that. I assume they feel that listening attentively, nurses do that all the time, and it was something that didn't need to be specific. And then to assist people in meeting their goals in culturally and spiritually appropriate care. I think this is an important addition because it does speak to not just the cultural, but the spiritual part of death and dying. Okay, maintaining privacy and confidentiality. Again, they have included the wording for the nursing process, which I think is very important. Number 10. Just bear with me a minute. Number 10. Oh yes, social media obviously has kind of blown up in all aspects of life. Anyways, they've put some very specific information in here regarding social media and the importance of maintaining privacy and confidentiality, not only of your patients, but including, you know, your colleagues as well. Again, something else that's changing in our society is the idea of gender. Just the word gender and gender expression have been added. Gender identity was in the previous draft iteration of the code, but they now have included gender expression and gender as well. Number 4, nurses don't engage in lying, punishment, or torture. If they do believe that, it's always been that a nurse would intervene. But now it's not only if they see these behaviors, if they're observed, but also if they have reasonable grounds to exist, reasonable grounds that suspect this occurrence has had it. So if you have some idea that some workplace bullying or inappropriate behaviors in between co-workers or even a nurse and a patient, even if you suspect it, that should be brought forward to somebody's attention. Okay. Oh, the addition of the criminal code to number 7. This one is talking about nurses' moral beliefs and providing care. It may not be in with their moral beliefs. They do provide alternate care, but there's nothing in the criminal code that compels a nurse to have to assist in medical assistance in dying, which has become very huge in the nursing field in the last few years, as Carolyn has said. So there's just that clarification that you can't be compelled to assist anyone with that. I think will put several people's minds at ease. So. Okay, so with and again, I just highlighted with part 1, do you have any concerns about the ethical responsibilities section of this document? We'd like your feedback. If anybody has anything that they would like to bring forward to us right now, certainly type it into the text box. If not, this is one of the questions that is on the survey, and we'll give you the link to the survey at the end of the presentation that you can go, and if you are more comfortable just making your comments there and anonymously, that's fine. But we'd really like some feedback if there's any concerns that you have.
Yes, and so we have only a few people on today, and so let's just check in and see. Terry and Donna, are you still on? Do you have any comments on the first section, part 1? No comments. Okay, thank you very much. All right, well, with that, we'll move on.
We'll move on to part 2. The title has been changed. In the first draft, there was nurses as advocates. Not sure why that was changed, but there are several societal issues that do impact health and well-being. So I think ethical endeavors to address those societal issues is probably some good wording change there. Preamble has been rewritten, but it contains many of the same elements as the previous draft. About half of it was dropped. There's a new endeavor, number 10, which is promoting participation of persons considered incapable of consenting to care in the health-related decision discussions that affect them, such as minors or people with impaired mental function. So again, just clarifying that, bringing that, to the forefront, making it visible for people. And then there was originally a endeavor that was listed regarding MAID that has been removed from this finalized copy here. So again, any concerns with the ethical responsibilities in this document? If anybody has anything to say right now, we'd like to hear. Otherwise, again, this is a question that is on the anonymous survey, and we'd really appreciate if anyone would, or if everyone could respond to that and just let us know if there's anything of concern.
That sounds good.
Okay, and then the following questions are just other questions that are contained on the survey. Just like to get feedback from our members if there's anything specific that they feel, any supports or resources that would help with the implementation of the code. If you have any specific ideas, we'd sure like to hear them. Again, question on the survey that you can answer. And I guess the big question is, do you recommend that the SRNA Council adopt the Code of Ethics for Registered Nurses 2017? And again, there's a yes and there's a no, and there's also room for comments. So if you want to provide us with some comments, we'd be glad to take that forward to council. And then we always like, if there's something that didn't fit in the boxes of the previous questions, is there any additional comments that you have? We'd like to hear those as well. And then finally, if you have any questions, there's the practice advice email, as well as the numbers, and our SRNA consultation questions. Go to professional conduct at srna.org and click on that link. It is there. It's 7 questions, and it's on our website under new and noteworthy.
Well, excellent. Well, that draws our webinar to a close, our consultation webinar. I just want to give everyone an opportunity here to add anything further. Shirley, any further comments as we wrap up?
I would just like to add that the document is a very rich resource and does really respond to contemporary nursing and the changes and some of the ethical dilemmas. Appendix B, applying the code in selected circumstances, can be very helpful to some of your practice questions. In addition, the glossary, excellent, very clear definitions. So as you work through it, it can be very helpful. And I know for myself, this will be one of my goals in my learning plan for continuing competence for 2018.
I just want to expand on that glossary comment that you made, Shirley. I myself took a walk through it, and they're using current terminology, what was actually being used in the workplace. So it might just be a change of a couple of words, but it is what is being used today in the workplace, in the practice settings. So I think that's important. I think that will help people, help guide people.
Great. And I'll just close with a great big thank you to, first of all, someone that's not even here, but is here because she's worked behind the scenes, and that's Erica Vogel from the regulatory team. And a big thank you to Erica Cheryl, Reese, and Erica, you've been worked behind the scenes to do the analysis, to set up the surveys, to look at the results.
Great.
Massive work, greatly appreciated. And then the analysis and presentation today. And Shirley, thank you very much for your key input today and collaborating together and getting the consultation done, because it's such an important document. It needs to go in front of our council, and we don't want to put it in front of our council without your input. So I'll end by a call to action to take a look at it and share your feedback. It's very important to know whether you have any concerns and would say no in particular. But if you like it, we want to know that too, and we want to know why as well. And finally, what kind of resources, if we did move forward, what approach would work best, would be very helpful as well, all of those items. So with that, a big thank you from the SRNA team, and hope everyone has a great day, and we'll keep in touch with you through our website and through our bulletins and messages. Take care, everyone. Bye.
Bye for now.
Bye. A session at the Education Day would be good to help inform members before they vote on the bylaw. Ooh, that's good. Thank you all. Great job. Thank you. Great suggestion. You know what that means?
Yeah. One more time.
I don't want to.
One more time.
I think we do it for the least.
Yeah, I don't know.